Hi all, this is Ariel Lehaitre, physical therapist and Pilates instructor. I'm going to try this again. This is my first Facebook Live experience. So if you're here, please comment, chime in, let's have fun together. If you're watching this afterwards, please feel free to message me with questions or comments or schedule a call. I'd love to hear from you. I'm like I said, Ariel. I'm a physical therapist and Pilates instructor and educator. And today I wanted to talk about low back pain, specifically about load and low back pain. And the reason I'm bringing this up is that I think it's some misunderstanding in the Pilates industry. And I think that we're taught as Pilates teachers, we're trained in the repertoire, we're trained in movement observation, we're trained in corrective movement, but we might not be trained or taught some clinical knowledge about conditions such as degenerative disc disease, which is probably one of the most common things you'll see as a Pilates instructor. You know, right now in this industry, it's booming, right? We have access to Pilates studios on pretty much every corner of at least where we live in California. And that the beauty of that is that, people do have access to it. However, the challenge with it is that Pilates instructors often are not equipped with the knowledge they need to work with the clients or the diversity of the clients that they're seeing. And so today I'm hoping I can fill a little bit of this gap between Pilates training and clinical knowledge by talking about lumbar disc load. So let's just think for a moment about whether you've ever had the experience of having somebody come to you, a client, and come to class or even for a private session. And again, maybe in their late 40s, early 50s, currently don't have any back pain. And then potentially after the first few sessions, come to you and say, yeah, I had a lot of great muscle soreness, including my back. My back felt very sore. In fact, I felt like I didn't really want to sit for a day or so after our session. So I think most of us have probably experienced this at some point during our teaching career and questioned whether the exercises we gave were appropriate. So let's talk about appropriate exercises for clients that have low back pain. And I want to use a reference by a gentleman named Knockomson. And this graph is actually in the description of the live presentation. And this was done so many years ago. In 1976, a Swedish researcher named Knockomson actually put pressure transducers into real live patient spines to look at how much pressure was in the lumbar spine segment based off of millimeters of mercury. And what he found continues to actually still impact how we work with low back clients in the healthcare field as physical therapists, health practitioners today. Because it was very interesting to see that in supine, you can have as little as 25 millimeters of mercury of load on the low back. And then that's going to exponentially increase to almost 4 times more in standing at 100. And then if you look at like poor sitting posture, you're looking at like 140 to 150 millimeters of mercury of pressure. And so what does that mean for us as movement teachers, as Pilates practitioners, is like if we're working with clients that are coming to us who have potentially spent the majority of their day in sitting, do we want to give them more seated exercises that are loading the spine? Again, we want to look at the cost-benefit ratio. There might be a reason we do that. There may not be. But we also want to look at how we are choosing to train their core. If you look at the roll-down position here, this was measured at 210 millimeters of mercury of pressure on the spine. That's significant. You look at full swan at 180, and then you've got 100, like a full 100 with both legs out, bilateral straight leg raise at 150 millimeters of mercury. And so, again, we need to really think about the construct of what we're teaching. Like, how are we teaching these clients that have low back pain? So, exercises that cause load. We have roll downs. We have teaser. We have saw. We have the rowing series on the reformer with full forward bend. Inversions such as short spine, long spine, monkey, tower. And so those are exercises, again, that might feel productive at the time and may not cause a client symptoms, but long term really may be injuring, not just not serving this client, but causing a long-term problem for this client. And we can train them really safely with alternative exercises that might be in supine, side lying, or quadruped. All of the 90-90 supine arm arc series, dead bug type of variations, modified bridging work, modified 100, work in quadruped, a quadruped leg press, a quadruped arm pull on the reformer. These are all very safe, wonderful exercises that a client could be extremely challenged with, but then again, not putting their low back at risk for worsening of degenerative changes that they might not be even aware of. Okay, so the reason I'm bringing this up again is not to scare you or make you feel like somehow you're hurting clients, but it's more really creating an awareness of how intentional we need to be when we teach exercises in Pilates, because there's a lot of very beneficial exercises, and then there's exercises that don't serve our clients, and we need to figure out how to work with the repertoire, how to create variations that are safe and productive. So because I've found that there's this gap with my experience, I've created what's called Clinical Instructor Academy. And I'll be putting the link to our website and our course page in the live discussion. But essentially what this program is it's a training and mentorship for Pilates instructors to learn more about injuries. We go over the lumbar spine, the sacroiliac joint, shoulder conditions, knee conditions, hip conditions, pretty much the most common orthopedic conditions that Pilates instructors will see at studios, at gyms, at therapeutic centers. It really doesn't matter what setting you're going to start to see these clients. And we'll go over them in full detail together with case studies, indicated exercises, contraindicated exercises, as well as just frameworks for how to think about working with people that have these conditions. We also have a more advanced training coming and curriculum for an advanced Pilates specialist certification, where we'll be addressing conditions like osteoporosis, hypermobilities, scoliosis, and things of that nature. So please feel free to message me, Academy right now, or ping us, DM us, and we will send you more information, or I'm happy to even hop on a call with you to talk a little bit more about clinical knowledge training through Clinical Instructor Academy. I'm deeply passionate about what Pilates instructors' capacity for healing their clients is, and I want to be able to help provide a little bit more support for those instructors that are feeling worried, that are lacking the confidence, that feel insecure, concerned about their choices they're making with their clients. Let's serve our clients better. Let's lower our liability risk. Let's create better outcomes for the clients, for the studio owners, for the instructors, for everyone. So please let me know if you have any questions about the load graph or exercises that are indicated or contraindicated for the lumbar spine. I'll also put a link for my book, which is Lumbar Pathology for Pilates Instructors, in which I go into a lot more detail about which exercises are more specific for different conditions. So it goes into a lot more detail as well about how to unload clients and how to help serve your clients that have back pain or have back conditions and may not have back pain, but we don't want them to have back pain. Okay, guys, thanks for hanging in there with me. I really appreciate it. I hope to be doing more live presentations and stay connected with you guys. Have a great Friday.